Hi everyone and welcome to another SDF COVID-19 webinar. I'm Dave Little, CEO of SDF, and today we're marking Volunteers Week by hosting this SDF COVID webinar, which is entitled Volunteering Under COVID-19 Lockdown, Supporting Volunteers and Expanding Opportunities. Volunteers provide an important contribution to many organisations across Scotland, including SDF, where we have a range of volunteering opportunities including our peer research projects in East Dunbartonshire, East Ayrshire, Tayside and Fife. And we also have other volunteers working in media and e-learning. Yet under the current COVID-19 conditions, the support that volunteers have been able to provide and receive has been greatly affected. This webinar will focus on how volunteering has been impacted on by the lockdown. Speakers will explore the challenges and opportunities which have arisen and discuss lessons learned that can influence volunteering in a post-lockdown world. We have 4 speakers joining us today: Allana Fotheringham, who is Investing in Volunteers Manager at Volunteer Scotland; Lauren Gibson, who is Lead Pharmacist for Substance Misuse in Prisons in NHS Lothian; and Stephanie Grohmann, University of Edinburgh, and the last 2 both work with the Edinburgh Access Practice. Then we'll hear from Emma Hamilton, SDF's Head of Inclusion and Peer Engagement. We'll hear from each speaker in turn, and then we have a question and answer session at the end. Attendees can submit questions throughout the webinar. The questions tab appears on the control panel, which should be on the right side of your screen. Austin will join us for the discussion session at the end of the presentations, where he will summarize the questions being asked by yourselves, and I'll put those to the speakers. So now, can I ask Allana to present, please? Thanks, Allana.
Hi, my name's Allana and I am from Volunteer Scotland. I have worked with Volunteer Scotland for 16 years now, and my role is the Volunteer Practice Manager. And my main role at Volunteer Scotland is delivering training to voluntary organisations and also delivering Invest in Volunteers Award for Scotland. And today I'm going to give you a brief detail about what Volunteer Scotland have learned since lockdown. Since we went into lockdown over 10 weeks ago, we had to react very quickly to this to support volunteer organisations. And what we decided to do was to implement some support sessions via online learning. And we did that over a 6-week period, where we spoke to 117 volunteer programmes and heard about what the challenges were and what the concerns were that was happening during lockdown for organisations, practitioners and also volunteering. So I'd like to share some of that with you today about some of our learning and about how we can support you moving forward. Next slide, please. So the key things to remember about during this current situation is about where you get your information from. So we've been making it clear to organisations and volunteers that you get the right information for yourself and for your organisation. And we understand that at the start of lockdown, there was a lot of information to take in and there was a lot of resources that you were getting signposted to. So here is some of the key information for you. Ourselves at Volunteer Scotland, we're trying to pull all information together and put it on our website and put it into columns that are more sensible to yourself. So there's information about volunteering, there's information for volunteers, there's information for organisations, and there's information regarding training at the current crisis, and there's also information on disclosure services and how you access disclosure services during this period of time. There's also Scottish Government information, so we are abiding by everything in the Scottish Government and pulling that together. That's also a vital website to be going on to. Ready Scotland is the website that's been pulled together for volunteering, on how you can volunteer during this current crisis and what support you can get during volunteering. Ready Scotland has how you can volunteer through NHS and how you can volunteer through your community reserves volunteers, and how you can volunteer in your local area as well. British Red Cross is offering the community reserve volunteers, so if you are interested in volunteering in that aspect, then please go to British Red Cross. And if you are interested in volunteering in your local area, you can find that information through your local third sector interface, which is your local volunteer centre. If you don't know who your local volunteer centre is, please go on to Volunteer Scotland's website and you'll be able to find that information. If you can't find anything that you are looking for, or if you're struggling with anything, please contact Volunteer Scotland. That is our role, to support you through this current situation and to signpost you to the right guidance for you. So some of the things that we've learned during the sessions that we've been delivering is the impact that lockdown has had is that volunteer programmes have stopped, full stop. Some volunteer programmes have had to stop straight away, and they're not able to offer the services that they used to offer before. And that's had a massive impact on the beneficiaries who used to get that support. If that was support through learning, mental health support and food support, a lot of these services have stopped straight away, and it's had a massive impact on the beneficiaries for that. We've also experienced that the third sector organisations have furloughed their staff, which has also had a massive impact on volunteers. So volunteers have been connected with organisations for a number of years, and they've had a lot of support through that organisation and those staff members. And that point of contact was then furloughed, and they had no point of contact at all. And in furlough legislation is that once the staff is furloughed, that you're not able to volunteer for the staff, volunteer for the organisation, or volunteer or work for the organisation. So they've not been able to support volunteers at all, which has then left volunteers feeling isolated. That volunteers are used to their routine and getting up and getting support from organisations and from other volunteers, and they've now been feeling isolated in this situation with no support at all. We've also realised that some volunteers are also not technical on technology, and they don't have access to Wi-Fi. So they're not able to find out about other opportunities that are available at the moment, or find out about support that's available, because they don't have access to Wi-Fi or internet. And they can't go out and find out about that information as well, which is making isolation a lot harder for volunteers. We also like to look at the legacy. And at Volunteer Scotland, one of the things we like to talk about is never waste a good crisis. And we've been thinking about that over the last few weeks as well, and thinking about what is the positives. We're talking a lot about negatives and how we support people, but let's put a little spin on that and think about what the positives are. And some of the positives that we've seen is that there's new volunteering opportunities out there now. We've got virtual volunteering opportunities. There's a lot of virtual befriending going on, which is allowing befriending organisations to recruit more volunteers who they wouldn't necessarily normally recruit. And they also don't need to recruit local volunteers anymore, because they are able to do it virtually online. So we're seeing new roles, which is attracting new volunteers and attracting more volunteers. We've also learnt that technology works. Before, we've never explored technology in a way that we've done it today in this day and age. Before, I have never delivered online training before. I've never delivered Zoom training before, and I'm now doing it daily. I had a fear of it back at the end of March, but now I actually love it, and I really enjoy using this technology to connect with people. So I feel that this technology is going to be in the future, and it's going to make a massive difference in the future for everybody's everyday lives, but also to volunteer programmes, because it's offering lots of different opportunities where we don't need to travel anymore, and we don't need to put more time into volunteering. We can put less time in and do it in a different way. And we've also discovered different ways to support volunteers. So we've found different ways we can support volunteers using phones, using technology on Zoom. But the main thing on this one is we're actually having fun. I've heard a lot of volunteer programmes over the last few weeks about how much fun they're having on Zoom, and it's great to hear those experiences of people having bingo nights and people having quiz nights, coffee mornings, comedy nights. All of these things that we've been hearing has sounded so much fun, and everyone seems to be enjoying it, which is a good thing that's coming out of this. And we hope that continues in the future. So if you're doing a monthly quiz, how does that fit into your future, or a monthly bingo session? Where does it fit in the future of volunteering as well? So the main thing, the message that we're sending to people is about supporting volunteers during this period of time. So having regular communication with your volunteers and managing those expectations. So being clear when you're going to contact your volunteers, let them know that you'll be contacting them monthly or every 3 weeks or every week, so you can manage those expectations and they know when they'll get that support from your organisation. Regular check-ins. It's good just to check in how your volunteer is and how they're feeling and how they want to continue volunteering. So have those regular check-ins with your volunteers. Volunteer buddy. We heard about this one about 6 weeks ago, and I thought it was an absolutely brilliant idea that the volunteer manager or coordinator is spending so much time trying to support volunteers during this crisis, and they've got 100 volunteers that they need to support. So some volunteer programs have been doing volunteer buddy systems where the volunteer supports the volunteer. It takes the onus off the volunteer manager and practitioner, but also allows the volunteer to connect in with a volunteer that they used to volunteer with. Volunteers don't connect with your organisation to volunteer, but they have made friendships within your organisation, and they'll be missing that as well, that connection with another volunteer. So the buddy system's absolutely brilliant. A point of contact. Just be clear that the volunteer has a point of contact and who to contact within your organisation, especially if you're doing a furlough system. I know people are doing 3 weeks on, 3 weeks off. So just let the volunteer know who that point of contact is. Being flexible, so thinking about all the ways you support volunteering, online, phone calls, text messages, and even people are going back to letters and sending letters to volunteers. Just find out what best suits your individual volunteer, and allow your volunteer to have an opportunity to give feedback, and that can be through surveys. We've heard about a lot of surveys that are going out, and they've been absolutely brilliant responses that they're getting back from that. We've seen a high increase in response to survey rates as well, so please ask your volunteers for feedback during this period of time. And finally, the key points that we want to share with people is share the correct valuable guidance. So from the information we've said, the Scottish Government, Volunteer Scotland, Ready Scotland and your local TSI, pick one or two that suits yourself and just stick to those valuable guidance place sources instead of going to them all. Keep volunteers safe while volunteering during COVID-19. Please put your volunteers first and ensure you're keeping them safe to the Scottish Government's guidance. Make sure your volunteers feel supported and have regular communication. And always remember that volunteering is a free, willing, given choice, and you have to respect any decision your volunteer makes. They may stop volunteering and never return to volunteering, and that's a free choice they still have. And finally, volunteers should always still have a good experience with your organisation. Thank you.
That's great, thanks. That's a terrific overview, Allana.
Thank
We'll
you.
move straight on to our second speaker, Lauren Gibson.
Great, thank you for the introduction. So yeah, my name's Lauren Gibson and I'm the lead pharmacist for substance misuse and prisons in NHS Lothian. In my background, I've worked predominantly within substance misuse and homeless healthcare and sort of prison healthcare for the past 10 years, and I've been really lucky to have worked with a great variety of volunteers during this time from various organisations in various settings such as day centres, night shelters and outreach teams. And I've found that experience to be extremely valuable, not only to the organisation itself, but also to the patients and the people that we are working with, and also to myself and clinicians. I've learned so much from working with volunteers that you probably wouldn't learn from a textbook. So it's been of great value to me, and for that reason I'm really pleased that I've been asked to speak today on this. So what I'd like to chat about is a bit more about the work that's been going on in Lothian and the projects that I've developed during COVID and how the volunteers have really underpinned and supported this. I think COVID has changed the way a lot of services work everywhere, and it's really brought volunteers to the fore. And in our area, you know, of drug and alcohol recovery is no different, and the volunteers have really done a fantastic job. So I've got 3 examples, and each example is of a different group and slightly different group of volunteers, and I hope that gives a little bit of a flavour. So the first group would be with the work done in the Salvation Army. Now that is the Salvation Army in Niddry Street in Edinburgh City Centre, and that's run by Susan Grant and her team there. I've chose that as well because I've actually worked in that centre providing clinics, so I've seen firsthand the kind of ethos and the great energy that's in that centre, and I think the volunteers really massively contribute to that ethos, and it's a really important element. So the volunteers in Susan's team really develop organically from the people that use the centre, the people that access the services, so there's a real feeling of lived experience. Which is extremely valuable. I think the wisdom, lived experience volunteers can impart, no one else can, and they can really help people in a very unique way. So it's a real sort of community feel in Niddry Street and a real sense of social connectedness, which I think is a really important part that volunteers can give. So volunteers, as I say, they're developed quite naturally. They'll discuss maybe their interests, things that they like to do, and Susan and the team will take that and sort of try and provide a structure and support to develop those skills and to bring them back into the centre. So prior to COVID, it would be things like preparing meals. Quite a lot of good chefs. I had lots of lovely breakfasts and cakes and lunches when I worked there. Some really talented people, but of course COVID has stopped that. So everything has moved online, hence why we're all on this webinar. So the volunteers have really stepped up and became very IT savvy. There's been mobile phones distributed free of charge to volunteers and to those that are vulnerable, that need the services. And there's been lots of Zoom meetings, virtual meetings, support groups, which the volunteers have access to training for and been a real key component. So it could be anything from online yoga, which I'm sure is very interesting, looking at everyone on Zoom doing yoga, to quizzes and groups, but also to the more serious, more clinical aspects such as CBT-based psychosocial therapy groups. The volunteers have been key participants and leaders in these groups. And I think it's important that to note that the volunteers have had access to the same training and development materials for these CBT psychosocial groups as the paid staff have. So I think that's a really important key with volunteering, to really nurture and train your staff and give them access to the same things that other members of the team have. I've also given training sessions as well to the volunteers around more of the pharmacy side of, substance misuse treatments, about methadone, buprenorphine. I think that's really, really important because it empowers volunteers. Often volunteers are having very important conversations with people, and it's good to have the knowledge and the empowerment of how these medications work. And I think that was quite well received over Zoom as well. Clinically at Niddry Street, they're also running a needle exchange and naloxone. So obviously that's socially distanced at the moment, but the volunteers are certainly involved in delivering that. And I think it's very, very well received. I think the ethos of Niddry Street, which is good for other services to maybe look at and try and emulate from Susan's work, is the community feel, the social connectedness. Everyone has a part to play, everyone's valued. And everyone as a team. It's a really safe environment, and people are free to develop and be part of a bigger picture, which is so important. I think to reimburse volunteers as well in the best way you can is important. A very bare minimum travel expenses and free meals and refreshments to really show that the value there. So that's a really good example of lived experience, and one which I have worked in and found very, very good. Second example of a slightly different group of volunteers is that which has been developed by the Edinburgh Access Practice and Dr. John Budd. He has gathered together a posse of medical students who are working as volunteers within the Access Practice, and I think they're slightly later years, third or fourth year. and they've been really fantastic. They've been involved in delivering prescriptions, which sounds really simple, but in COVID, a trip to the community pharmacy is fraught with waits and probably stresses, and I'm a pharmacist saying that, so that's actually been a very good job for them to get involved in. They've also been delivering methadone door to door, which has been hugely beneficial for those patients that are maybe vulnerable in the shielding group or have COVID symptoms and don't have anyone else to collect on their behalf. Especially a lot of the patients who are suffering from homelessness and at the moment are being housed in hotels and bed and breakfasts. So the students have been, pitching up on their bikes, cycling, doing deliveries, providing a vital service where no one else would have been able to deliver. On these door-to-door interactions, they're also providing naloxone, clean needles, and things like that. So that's been a great development and something I think would be really good to keep going. They're also out in the hotels at the moment, where I say that those suffering from homelessness that are being accommodated to protect them for COVID. There's various outreach clinics going on, and the students are right in there amongst it, providing healthcare, advice, seeing patients. So it's a full picture of what's going on. And I think the mix of volunteers, so the volunteers with lived experience, working alongside the medical students, who are also working alongside the third sector paid staff, who are also working alongside people like myself and the clinicians, is so important to have that mix. I think everyone has different things to contribute and everyone has equal value, and we can all learn from each other. So I think if COVID's taught us anything, it's to have a real mix of various people and backgrounds and purposes, and I think that really benefits services and should be embedded in the future. So the last example I have is from Lothian, and this is from the Specialist Substance Misuse team, which is led by Tracy Kluska. She has started a collaboration with Criminal Justice and the Community Payback team, the Unpaid Work team, and it's for those that are serving community payback orders to try and work those orders into, meaningful volunteering opportunities where they can really contribute, back to the communities they're in. So it's coming back to this idea of social connectedness and community time. And they have the collaboration with the substance misuse team and a lot of the social work there. And Tracy's done a fantastic job of training these volunteers to give peer-to-peer naloxone. Again, it was timely, the collaboration, as it was just prior to COVID broke. So they've been, delivering naloxone training, supply to those peers that need it. Also doing door-to-door naloxone. Also been delivering, food parcels to those in need for perhaps shielding. And it's really been providing a meaningful connection and connecting people back into the heart of the communities. And the feedback from it has been very positive, very well received, and it's helped to break down stigma. So essentially, I hope that's given everyone a flavour of what's been on in Lothian and how important the volunteers have been. And I think just to keep that as we move forward out of COVID would be great. And I think I've said enough.
No, that's terrific, Lauren. Thanks. Some really good examples there. Okay, thanks a lot. Can we move to our third speaker, Stephanie?
Hello, everyone. Hi, my name is Steph, and I'm a social scientist. I work at the Centre for Homelessness and Inclusion Health at the University of Edinburgh. And we work with a number of healthcare and social care organisations across Scotland. Among them is the Edinburgh Access Practice that Lauren was just talking about. And so over the past couple of months, since the COVID crisis hit, I've kind of doubled as volunteer coordinator for the Access Practice. And I've also done a little bit of online-only research on volunteering a little more broadly. And so what I want to talk about today is a couple of points that we've learned from that in terms of how organizations in the social care sector, healthcare sector function in such a crisis, especially when it comes to quickly bringing on board volunteers, integrating volunteers into their work, and what lessons can be learned from that, maybe hopefully not for the next pandemic, but for the next situation where volunteer programs become interesting. Because one thing that became quite clear to me in this context is that volunteering in peacetime, if you so want, in normal times, is something quite different from volunteering in a crisis in terms of, you know, what motivates people, what kinds of people sign up for what kinds of tasks. And I'm going to talk a little bit more about that in a minute. But so first, Lauren has just described this volunteer program. The Access practice at this point is running very, very smoothly and swimmingly. Of course, a couple of months ago when this was first starting, we had to start it from absolute scratch. So what we started with was a Word document with the names and phone numbers of a number of medical students who signed up for volunteering with the Access practice. And so this then ended me with me hand text messaging them to please send me their email addresses so I could send them the assignment, etc. So there was a complete absence of any kind of technology here to start with, or any kind of way to contact people quickly or give people the opportunity to contact the organization quickly if they wanted to sign up. So one point to keep in mind is to keep an infrastructure ready, not just for your existing volunteers, but also for any volunteers that you may want to bring on board if a crisis situation happens. So the second thing that we noticed was that organizations like in situations like that face two immediate questions. One is how to integrate volunteers, people who sign up, approach the organization into their existing workflows, because one thing that I've seen in work with volunteers across the board in all kinds of organizations is you get a lot of people with a very high degree of motivation, possibly also a very high degree of qualification and know-how, but these people haven't functioned in your particular setting, in your particular ecosystem yet. So you will have to make a certain investment of time and energy to bring these people on board and integrate them into your workflow, and you have to in some ways budget and account for that. And the other question is how to integrate your organization with other organizations that can support you in your volunteer effort. So in our case, this was the University of Edinburgh. So we had a plan to bring more University of Edinburgh students on board with this volunteer program. This turned out not to be as easy as we thought, because university structures are very slow and very bureaucratic, and there are a lot of considerations about student safety, etc. So when we're talking about something like the medication delivery program for the Access practice, this is something that universities, not just this one, would probably balk at in terms of formally sending students into an environment like that. So for volunteering tasks outside of relatively pedestrian, extremely safe home working assignments, it will probably be good to have some kind of infrastructure in place, either for your own organization to bring people on board, or then to link up with other organizations, as we've had from the first speaker, that facilitate that. So the next step, of course, is then training. So as you've had, there's now a very successful training program set up at the Access practice. This, of course, was also slightly haphazard, not just because we had to set up a training infrastructure in terms of come to terms with all this technology, etc., but also because we had to kind of anticipate what do our volunteers know, what don't they know, what do we have to tell them, and that's not necessarily straightforward in a situation with many moving parts, because assumptions are made or things are assumed that then turn out not to be very practical. So for example, we found out that actually for these medication deliveries, people need to have a certain level of clearance to work with vulnerable people. And so we had a lot of volunteers then on board who didn't have the right clearance. So this is something that could have been anticipated. And then the big point that I actually looked at in these volunteer interviews was what motivates people to sign up to volunteer, because that's not necessarily as straightforward as you might think. So of course, when you ask people directly, why do you do this work, they talk a lot about the motivations you would expect. So you know, a kind of altruistic desire to help your fellow citizens, to help society get through a crisis situation. But you also hear other motivations, and I think those are worth for organizations to have on their radar, because people don't all volunteer from the same kind of personal background. So, for example, one thing that I heard a couple of people say was that they perceived of themselves as relatively privileged in society, and there was also almost a sense of not only wanting to give back, but having to give back. So, you know, people who tend to have a very high degree of responsibility, a very high degree of moral demands to themselves, may actually put their own well-being second because they think that their privilege in some way puts them in the position that they have to. Another one is personal attachments. So one thing people said was that, you know, I have no family, I have no children, I have nobody would be particularly bothered if I catch COVID, so might as well put myself out there. And as you can probably imagine, this might become problematic when you're dealing with a person who may have some adverse prior experience. That means they're not necessarily fully aware of their own boundaries concerning their health and well-being. And this, all these kinds of factors come into people's motivation. So also, I think that previous speakers have already said there needs to be some kind of infrastructure to provide supervision to these people, to provide a kind of psychological anchor, to check in with them and make sure that they're staying within the boundaries of their own health and self-care. Then another quite interesting factor is the relationship to local grassroots groups, because during the COVID crisis, lots and lots of local groups have sprung up, mostly on Facebook and other social media, of people organizing locally. And these are often existing volunteer groups who already have a lot of local knowledge about contacts to vulnerable people, etc. So they know what's going on the ground. And so joining up with these organizations, with self-organized grassroots organizations, or simply spontaneous groups, can be a very good way of locating, for example, needs that you might not be aware of as a formal organization. At the same time, I had a kind of comparative population where I was working with a volunteer group in Manchester. And this is a tenants union, so this they had worked in these local areas for quite a while. And then when the crisis hit, they were amongst the first groups to organize a response, as in food deliveries and various errands for vulnerable people who had to self-isolate. And when the official organizations came in to provide relief, the attempt to work together with the grassroots ran into all kinds of problems. First of all, because official organizations were all competing for funding, and they were kind of trying to bring these grassroots groups on board as a sort of asset to sell to the funders, which the grassroots groups did not appreciate at all. There were questions of competence, because of course the official organizations wanted to run the effort and wanted to use these volunteers, but these groups were used to working on their own accord. There were problems of data security, because these people had a lot of personal information of vulnerable people, the grassroots groups, but they would not necessarily share them with the official organizations coming in. So as far as I could see, this worked a lot better in Edinburgh than it did in Manchester, but it's definitely also something to keep on your radar for a quick and efficient crisis response, how to link up with local groups, or even better, how to cultivate relationships to local grassroots groups before a crisis happens. So And finally, the final point, which seems fairly obvious, but was not that obvious at all over the past few months, is the importance of organizations using their own social media and their own communication systems. Because my role as volunteer coordinator at the Access practice has now practically become redundant, but should have been redundant to start with. If, you know, there is a social media portal that people can engage with directly and organize things much more quickly and efficiently than I can sending handwritten text with my phone. So the good news is I'm no longer needed, because everything at the Access practice now runs very smoothly and professionally. And maybe these couple of points can inform better responses in the future.
That's great. Thanks, Steph, for those reflections. Really, really interesting and helpful. Can we move to our final speaker? That's Emma from SDF.
Thanks, Andy. So yeah, as Dave mentioned, I'm Emma, and today I am going to speak to you about volunteering at Scottish Drugs Forum during COVID-19. Next slide, please, Andy. Okay, so first off, I thought I'd give you an idea of the range of volunteer roles within the organisation. We currently have 4 different roles at the moment, and I guess what we're most known for is our volunteer activity that revolves around peer research. And actually, we've had volunteers undertaking peer research since the mid-90s at Scottish Drugs Forum. Certainly our greatest number of volunteers are peer researchers within Scottish Drugs Forum. We also have volunteer roles within Hepatitis Scotland, who also undertake peer research, but are also responsible for facilitating and supporting forums around hepatitis. We have a volunteer who supports the work of our emergency response lead, Sophie Gibbon, and we also have volunteers who support our communications team, and they get involved with interviewing staff, interviewing external stakeholders, writing news pieces and blogs for all our external and internal communication stuff. At present, we have 32 volunteers, but typically we sort of have around 30 to 40 volunteers in a year, depending on where we are in our recruitment phase and also where people are in their volunteering activity with us. We also were awarded the Investing in Volunteers Award in December 2018. Which is the UK quality standard for demonstrating good practice in volunteer management. So it's something we're very proud of and something we hold as the foundation for our volunteer activity within Scottish Drugs Forum. Next slide, please, Andy. So now I'm going to talk to you about the impact of COVID-19 and lockdown on our volunteering activity. I'll firstly focus on our volunteers. So coronavirus and lockdown has had an impact on the day-to-day activity of all our volunteers in exactly the same way as it has for each of us, actually. Our volunteers are demonstrating and talking about their increased levels of anxiety around their own health and the impact coronavirus could have on their own physical health. But they're also mindful of their friends and their family's health and have a fear around the virus and friends and families getting unwell. They've also had experience of their friends and families becoming unwell with coronavirus and other illnesses, and actually a few of our volunteers have been bereaved as a result of coronavirus or other illnesses, so increasing support around that around this time. Volunteers have increased childcare or other caring responsibilities. They have concerns around their own physical and mental well-being, and especially at a time when health and other support services are closed or when the support they would usually receive is massively reduced. We have volunteers that are having to shield and the impact that has on what they're able to access. There's been a change to their formal and informal support networks and the method and frequency in which they're able to engage with different supports. Many of our volunteers do not have or did have limited digital access. So many of them did not have smartphones, or if they did, they didn't have Wi-Fi access and no money for data, especially with the increasing financial burden of being in lockdown. Some of our volunteers were not familiar with or used to using apps for digital communication, and are having to get used to the different technologies in keeping in contact with services, friends and families, even things like online shopping. Our volunteers describe lockdown especially as having a huge impact on them socially. They're reporting a reduction of their peer support and their normal daily routine being negatively impacted. And as such, there's an increased sense of isolation, loneliness and boredom. Like our volunteers, our coordinators have had to work around their own anxieties around the current situation. And instead of the usual work from home, they're attempting, and you'll all have heard this, attempting to work from home during a crisis. Again, working around their own home commitments. So, you know, having again managed childcare, and even working at home when there's another person in the house throws up its own challenges. Our coordinators have had to adapt to a fully digital way of working, which was not the norm for us at Scottish Drugs Forum, and actually was far away from our everyday work with our volunteers. Our coordinators have had to support and engage our volunteers in a very different way that was rarely done previously. And as well as this, they've had to look at our work plan and see what could be adjusted to still meet our funders' expectations, but still provide that support and engaging activity for volunteers. So the tasks, there's also been an impact on the tasks that we could do. We've had to completely change our work plan to incorporate our new way of working, and set new timelines for various pieces of work and different activities we had planned. We've had to be creative and develop new projects that volunteers could get involved in virtually, and support volunteers with their digital needs so that it could be an inclusive activity for all our volunteers to take part in. We've also changed all our volunteer training and support sessions to be delivered virtually, or over the phone, depending on how the individual would like to engage with us. But you know, that's quite a big task, changing all your training to an online virtual method, and keeping it engaging while still meeting the learning outcomes. With all this in mind, with all this impact in mind, we've managed to learn some lessons along the way. So the first lesson that we've learned is around technology. We have traditionally been resistant to engaging with our volunteers using technology. We much preferred a sort of face-to-face way of supporting and engaging volunteers. But actually, our volunteers have been able to engage in training, support, and deliver tasks doing peer research, for example, using virtual methods. Not only this, some of the webinars and training tools that have been developed have actually been a great way to develop or further develop our volunteers and some of the things they're able to get involved in. A lesson that I've learned is how adaptable we all are. Our volunteer coordinators and volunteers have adapted to this situation well. They were quickly able to identify and overcome challenges that arose as part of the lockdown, ensuring that regular routine was remained and regular contact continued. I've learned that our model of volunteering is flexible. Again, we traditionally engaged face-to-face with our volunteers, and you know, I would hate to lose that because it has a place. But this situation has highlighted that we can engage with others who may not want to come to an office to do volunteering, or maybe have less time, so can't afford that travel time to travel to and fro to different engagements. So virtual volunteering opportunities and virtual engagement and doing roles is another way of being able to engage SDF's volunteering as a whole, and the opportunities that it brings. And as such, we've recognised that it has increased opportunities for whole volunteering across the organisation. So actually this week, because it's Volunteers Week, we had one of our whole volunteer events. We had a live Zoom big volunteer quiz, and actually all of our volunteers could engage at that in the same time. And when you have a large number of volunteers, it's hard to get them all in the same room at the same time. So actually it was a great way for people to to introduce themselves to each other and have some chat and banter, and you know, some healthy competition in a quiz, which I didn't fare very well in, I have to say. There's opportunities for wider engagement with a range of different people who would be interested in the work that Scottish Drugs Forum do in helping support us in our vision and our aims as an organisation. And we have scope. It increases the geographical reach that we could have for our volunteer roles. So this leads me to the opportunity. So I've mentioned there, I see that the lessons we've learned has allowed us to identify that we could have a much greater geographical reach for volunteers and engage with people that we typically wouldn't have been able to have as volunteers because we don't have a presence, an office presence up there. By widening our geographical reach, we're able to engage with people in rural areas where transportation can be troublesome to get to place. So it really does offer an opportunity for a Scotland-wide volunteering programme for Scottish Drugs Forum. The use of technology is another opportunity for us to actually have more regular all-volunteer meetups, including all volunteers. So I mentioned the big volunteer quiz, and we would typically meet arrange to meet all of our volunteers together around 3 times a year, hopefully 4. But actually this technology allows us a greater opportunity to do that more often, but also engage people in virtual training, a lot more people in virtual training. Things like the volunteer training, specific volunteer training for different roles, and also the SDF volunteer induction, we can adapt that to be an e-learning and web-based. So it means that people don't have to travel to an office to engage in that. There's also new roles that we are developing as our learning increases around lockdown and coronavirus and just the opportunities that it brings. And as such, we are currently recruiting for a new e-learning volunteer. So if you would like more information on that, or if you know anybody that you think would be interested in applying for that, I would ask you to go to Scottish Drugs Forum's website and check out the role profile and see if it fits. So that's the sort of opportunities that we've identified through the last 10 so weeks. But what does the future of volunteering look like at SDF? Andy, if you wouldn't mind your next slide. So the future of volunteering at SDF is how I envisage it anyway, is an increased number of roles and opportunities for people to volunteer within the organisation across a much wider geographical area in Scotland. I think as such, we will be embracing technology, especially around our training and support, and actually really taking hold of that and supporting that for us to have a wider reach. But also that this has cast a sort of light on our unique employability pathway within Scottish Drugs Forum. You know, we offer a range of different roles for volunteers in the organisation. Volunteering roles, but that allows people to get very specialist training in drugs and alcohol, specialist training in the roles that they're delivering, and increased knowledge and understanding around things surrounding substance use. And this gives people, a lot of people, the opportunity or desire, motivation to move towards our addiction worker training project. So it highlights and sort of solidifies that pathway, I think, our unique employability pathway. So with that in mind, and in recognition of Volunteers Week, I'd like to thank our volunteers, past and present, and to recognise the value that each volunteer brings to our organisation and the work we do, and to applaud all of the staff who support volunteers at SDF and their commitment to ensuring we continue to demonstrate good practice in our opportunities for and our management of volunteers. Thank you very much. That's me.
Thanks very much, Emma. Can we have all of the panelists back now, and also my colleague Austin, if he can join us for the questions? Austin, do you want to kick off, as we've not got much time left?
Yeah, so the questions sort of group around 3 or 4 themes. The first one is the sort of practical issue of training. How are volunteers, when their roles changing, how are they trained and supported in that change to be ready for those new roles or duties? And otherwise do people have core training for all volunteers?
Allana, do you want to take that first?
Yeah, definitely. So we're talking about when people re-engage with volunteers, there is going to be a small change in roles, and there is going to be new roles adapted. So training is one of the things that we are encouraging organisations to do, is to do training or some form of induction to get volunteers back up and ready. And the form of way of doing that is using some of the technology that we are already using and delivering training over Zoom. And we are also looking at Volunteer Scotland on how we actually provide training for volunteer organisations on how to deliver Zoom sessions for inductions and volunteer training. The biggest barrier in that is that not everybody can use the technology. So not everybody has access to Zoom or to access to Wi-Fi at the moment, because volunteers come from a large pool of people. So how do we offer that same offer to everyone across the training pool? So we've been exploring that recently and are currently writing an Open University course with Health and Safety Scotland and other key partners on how we do that. And one of the things we have been coming up with is that at the moment we can social distance with one other person in one other household. So if you are looking to train one other individual, you can actually do that face to face as long as you follow the safety guidance that is put in place by the Scottish Government, and you do the social distancing, and you put all the safety procedures in place, and giving hand sanitizers if it's in a premises, and making sure there's places to wash hands and things like that. But we are working on that at the moment at Volunteer Scotland, and there will be an Open University course that will guide you through all of those and how you restart volunteering and volunteer programmes. I hope that's answered your question.
Thanks. Lauren or Steph, do you want to come in there? Or Emma, if she's still here? We seem to have lost her picture.
With our sort of training, I think because COVID, came around, a lot of our training had to be quite organic and quite flexible and quick. We hadn't envisaged, the problems we would face, such as patients that were shielding with no one else to pick up medication. So training for the volunteers that had to do that had to grow quite naturally and organically. I think because I'm a pharmacist, it was easier for me to put the training programme in place with them. A lot was done virtually. We also got in a guest speaker who was experienced in outreach and delivered a question and answer session with them. Protocols were written and guidance submitted, but it was a pretty organic process just because of the pandemic, but it seems to have worked okay.
Emma, you wanted to come in?
Yeah, sure. The roles and duties, certainly for our peer researchers, actually hasn't changed that much. They're still engaged in peer research, albeit the method is different. But what we do is we have regular one-to-ones with all of our volunteers, and we engage with our volunteers weekly in training and support. So we as we changed our methods to engage people differently in our research, we provided ongoing training to allow people to feel confident and comfortable to do that. But as an organisation, we have core training for our volunteers, including our core volunteer induction, as well as core training related to each role. For example, research methods core training for our peer researchers.
Okay, thanks. Steph, do you want anything to add to?
Well, as I said earlier, it's going to depend very much on your organization and the kind of work, what kind of training you need. Because if you are a medical provider like the Access practice, you have to consider things like personal security, personal protective equipment when interacting with patients. This is not the case when you're say working with vulnerable people in the community. So what I think our organizations need to do is anticipate these things to a certain degree, as in what can we learn from this about the training needs that we do have, and how can we have these things in place next time that we need them.
Yeah, Thanks.
And can I just quickly add in an extra there that sprung to mind about the training, a positive that's actually developed from the COVID and the work that's done. There's been an inclusive health training programme that's been developed by the GP Fellow in the Access Practice, and they're having sort of weekly education sessions and feedback, you know, with expert speakers, and that's to help the medical students that are engaged in this. So that's been a development that we have done, and we hope post-COVID that will continue, and the university might consider embedding that as part of a programme moving forward. So that's been a positive.
So that would be a continual programme with medical students going forward, you think?
I would love that to happen. I don't know if that's my decision, but it's been really well received, and it's given, you know, medical students a good grounding and an experience in working with patients with, you know, drug and alcohol and homelessness. And even if they don't specialise in that, it'll be a great grounding for whatever specialism they work in, as they will encounter patients in their future career. So one of the GP fellows, I can't take credit for that, Gillian, she's been devising that programme with John Budd, and I think it's really good.
Okay, thanks. Austin.
And well, I suppose that leads us on nicely to another set of questions that came in, was around what would be sustainable after COVID, what have we learned that we would like to keep in terms of opportunities and supports for people who are volunteering.
Okay, Lauren's answered that to some degree already. Steph, do you want to?
So yes, my first thought was going forward to tap into the resources that are there in terms of community engagement and in terms of the community self-organizing, maybe even outside the view of the official health system, and to tap into those resources would be absolutely crucial, I think, to keep this effort sustainable.
Emma?
Sorry, just unmute myself. Yeah, actually, this whole lockdown and coronavirus thing has demonstrated the opportunities in that we can have a much wider geographical reach. I think I mentioned it in my presentation. People know about Scottish Drugs Forum as an organisation. People want to volunteer with Scottish Drugs Forum. However, opportunities have been limited because, you know, we may not have a worker in that area that could facilitate that. By having a greater digital access allows people who live in more rural areas or areas that we don't have a presence to be able to engage with us and engage in volunteering roles that we can offer.
Thanks. Allana, I think we're almost out of time, so we'll give you the last word as the National Volunteering Organisation.
Thank you. The only thing I'd want to say at that point is that there has been a lot of change in practice, and there's been a lot of great practice created during this period of time, and let's not lose that when we get to the other side. Let's bring that new practice into the future, not go back to what normal used to look like. Let's create a new normal for volunteering and make a positive for volunteering moving forward, and using all these changes to create volunteering to be bigger in Scotland as well, to increase the opportunities and increase the support that we offer to volunteering moving forward, because we have seen absolutely fantastic changes that have been made, and we've had to do them quickly, and it's been absolutely brilliant. So let's keep that going and keep that positivity going with it.
That's a great message. Thanks. That's a good way to end. Okay, I'm afraid that's us out of time, and we've come to the end of the webinar. But this has been recorded and will be published on the SDF YouTube channel as soon as possible. You can view all of our previous webinars there. We will be sending out an evaluation, and it would be excellent if you could complete that for us. Our next webinar will be on the same time next Friday, the 12th of June at 1 p.m. The topic of the webinar will be on supporting people presenting to services with stimulant problems under lockdown and beyond. A link to register for this webinar will be included in the evaluation email you will receive, so it would be great to have you join us again then. So finally, I'd like to thank all of you for attending today, and a special thanks to today's speakers, Allana, Lauren, Stephanie and Emma, for what has been a very informative and engaging session. I hope you'll agree. Thanks again and goodbye.
Thank you.
Thanks, bye now.
Bye.
Bye.